My name is Dr. Bill Sterett. I'm with Vail-Summit Orthopaedics and Neurosurgery. So I'm just going to put a whole bunch of questions in here. I'm going to pull one out and see what it says. I hear so much about females and their ACL injuries. Why do female athletes have so many more ACL injuries than males? There's 3 modifiable factors, meaning you can control and maybe prevent your next ACL injury or your daughter's ACL injury. And there are 3 things you just can't control. It's just anatomically. The things you can't control, unfortunately, women have a smaller ACL than a guy. The female's ACL is about 30% smaller and 30% weaker. Second thing that's probably the biggest factor I see all the time is this term called hyperlaxity, or being loose jointed. Our elbows hyperextend, our knees hyperextend. We can put our palms flat on the ground when we bend over to touch our toes. If you're loose jointed, you have a 4 to 5 times higher rate of tearing your ACL than if you're not loose jointed. Fortunately or unfortunately, women tend to be more loose jointed than guys. The third thing that you just can't control, women tend to be born a little bit more knock-kneed. And when you stand up, look down, if you can touch your knees, but your ankles can't touch together, then you're knock-kneed. If you can touch your ankles together, but your knees don't touch, then you're bow-legged. So the things you can't control, being knock-kneed, unfortunately, being loose-jointed, and just having a smaller ACL straight out of your upbringing. Let's talk real quickly about the things we can control. When we've done studies, and we've published on this, that women in their jumping and landing patterns, women tend to land more straight-legged. Probably has to do with just that knock-knee things and some of the other factors that we talked about, trying to protect it with the bony architecture. But landing straight-legged puts that ACL at much higher risk. It's already at tension. All it takes is a minor twist or a little more hyperextension, it will tear that ACL. The second factor that you can actually modify, we want the kneecap to go right over the second toe. So as you go into a more flexed position, just make sure your kneecap is going right over your second toe. It's easy to do. So the third factor, how does that come about? Why are we going into this dynamic valgus? Well, it has to do with weak gluteal muscles. You can change that. So your gluteal muscles are what help prevent that dynamic valgus or that knock-knee as you're diving down. Those 3 things, if you can land a little more flexed position, as you're flexing down, get your kneecaps over your second toe, and then preventively really work not only on just quadriceps, because we all know, get your quads and hamstrings strong before you go skiing, but every sport, work on your gluteal muscles as well. You're going to protect your knees a lot better having a balanced muscle attack at it. I hurt my knee today skiing. How do I know if it's bad enough that I need to go to the emergency room? Great question. When in doubt, you need to see somebody just for safety's sake. By and large, the injuries that are bad enough that you should be seen get very swollen very quickly. If you develop a whole bunch of swelling inside your knee within the first 2 hours after an injury, it's usually blood, and there's only about 3 things that can cause blood inside of a knee from an injury within the first couple hours. It's a fracture. So you could have a little fracture that's not bad enough that you had to get carted off, but a fracture will cause a bunch of bleeding inside your knee. The most common one we see is an ACL tear. ACL tears will bleed because there's a little blood vessel right inside the middle of the ligament there, and that will bleed. Fill up the knee with blood within the first 2 hours. By and large, if you heard a pop and it got swollen within the first 2 hours, and when you stood on it, it felt unstable, more than a 90%, closer to a 95% chance you tore your ACL. The third thing is that you could have dislocated your kneecap. If you dislocate your kneecap, you would probably know what you're dealing with. Feeling of instability, lots of swelling, and heard and felt a pop, should probably get in, have it looked at. If not tonight, then tomorrow by one of the orthopedic surgeons in this valley. We've got a whole bunch of the best in the world. We really do. For whatever reason, for lots of great reasons, this small Vail Valley has become an orthopedic center of excellence for the world. Don't hesitate to come in and see any of us here. Everybody does a great job, and we'll take great care of you. What is an ACL? What does it do, and why do I even need it? I just happen to have brought a little knee model here, and this is a right knee. All the ligament is a band of tissue that connects one bone to another bone and crosses a joint. 4 ligaments about the knee, north, south, east, and west if you want to think about it, but the outer side is the smallest one. This is the LCL, or fibular collateral ligament, lateral collateral ligament. That stops us from doing that, obviously. This big one right here We don't hear so much about it, but it's the most common one injured on that ski hill. This is the MCL, or medial collateral ligament. That stops us from doing too much of this. If you think about why it might be torn in sports and especially skiing, because we're always loading up the inner side of the ski like that. And so we've constantly got the MCL on stretch. The biggest one in the knee is actually in the back of the knee that you don't hear so much about. It's called the posterior cruciate ligament. What that does, and you can see this hopefully on that camera, if I push the tibia, this is the tibia, this is the femur, push the tibia backwards, that's what stretches the PCL and tears it. On to the ACL, what you guys asked about. This is the ACL. Looks like a little benign, innocuous little ligament that connects the femur to the tibia. It's right in the center of the knee, goes at a little bit of an angle like that. We need the ACL to stop us from twisting. So the ACL is there. You go skiing moguls, cutting, twisting in soccer, volleyball, anything else, and we twist like this, that ACL tightens up. There's no muscle to fire, but that tightening just brings us back to the center. You twist the other way, so you're going right, going left, going right, going left. ACL stops us from going too far forward. Well, once that ACL is torn, there's nothing to stop us. So now you can twist, 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 and watch how much twisting we can do without that ACL. You can actually dislocate the knee, and you're putting a lot of shear strain on this, the cushion cartilage. You can live without an ACL. There's nothing, you're not gonna hurt all the time or anything else. Your knee will feel normal. But living without an ACL and continuing to do all these sports just puts your knee at an astronomically high risk of chewing up that meniscus, which then you will be coming to see us with arthritis. We'd much rather see you to prevent that scenario rather than treat the scenario. Take care of your ACL, but if you tear it, that's what you're gonna do is put your meniscus and the cartilage at risk within the knee.